The standard of care for diagnosing prostate cancer may be changing because of results now published from a head-to-head comparison of two different approaches. The question posted, the traditional biopsy versus an MRI. And the less invasive procedure is what may become the new standard. Dr. Ali Kazrayan from Kazrayan Urology is here to talk about the study and how it may dramatically change the way things are handled. So when you do a biopsy, it is invasive, it is uncomfortable. When you do an MRI, not so. Is this going to be the new standard?
I hope so. I mean, we've been very excited to have partnered with the people that led this study. And about 5 years ago, we started doing our MRI-guided biopsy. And the idea with this is the following. The ideal prostate cancer test should be minimally invasive. It should have few side effects. It should do a good job of diagnosing a higher proportion of men who would actually benefit from treatment, and hopefully diagnose less men who may not. Those what are called clinically insignificant or lower risk, low volume cancer, which the study actually talk about harmless cancers that may not benefit from therapy, so you can monitor. With this idea of this whole overdiagnosis, overtreatment dilemma, then controversy that's plagued prostate cancer screening, this is a test that could potentially reverse that, and we find it in our own studies and international studies that you can avoid unnecessary biopsies if someone has a negative MRI scan. This study showed that 28% of the men who had a negative MRI could safely avoid an unnecessary biopsy. We're not at the point yet that we replace the biopsy completely, because even in this study, if someone had an MRI finding that was of concern, it would be targeted. And so now we have the technology that if you find a tumor within the MRI scan, you can merge the images together and actually put a needle directly into the area of concern. It's mind-bogglingly wonderful.
Yeah. So this brings up the main question, the efficacy. How reliable is what we see on the MRI compared to taking that tissue sample?
And that's where the importance of training radiologists and urologists to be comfortable with reading the MRI scan, which in the big scheme of things is not a brand new technology, but it's a newer technology that's being applied to this. Again, with this, using this pathway, what they did with this study is they took 500 people in 25 institutions in 11 countries and randomized them to either getting an MRI first if they had an elevated PSA or an abnormal rectal exam. Things that you would be of concern, that usually we do the other pathway, go and do a standard 10 to 12 core biopsy. What they found was if someone had a negative MRI scan, 28% could have safely avoided a biopsy, and when they were followed, it didn't mean that later on they would get significant cancers that were missed. The MRI pathway, if a biopsy was down, found more clinically significant cancer, meaning cancers that would need treatment, and less clinically insignificant or more harmless cancers that we hope in the future, maybe we don't find them.
And I know you were telling me that 5 years ago you were involved with a study with the, was it National Institutes of Health, and basically it corroborated what this new study shows.
So we, 5 years ago, I've been trying to get the MRI program in place for a while, but we were able to start the program meeting with the University College in London and people there which are very, very innovative and pioneering in the MRI application to the prostate cancer diagnosis. We started our MRI program, and then we partnered with a team at NIH to get a device in place called the UroNav system, which takes the MRI image and the regular ultrasound that we typically do. You merge the images together, and it allows you to then target a region of interest within the prostate. So we're about 4.5 years deep into doing this, more than 400 cases, and we ourselves in our study found that, one, we diagnose more cancer. We are more apt to finding clinically significant cancer that men may benefit from treatment. Another thing that's really interesting is if you have a tumor within the MRI, like you see on the screen, now we open the door to considering what's called focal therapy, where you potentially just treat the region of interest, the area that has the cancer, and you leave the rest of the prostate alone, with the idea that the more prostate you preserve, the more function you preserve, and you have less side effects from therapy.
And it's all better for the patient, Dr. Ali.
Absolutely.
Cutting edge medical technology, and maybe the